Well, by now we are about 8 or 9 months deeply entrenched into the world of COVID-19. We know now that over 200,000 Americans have died from this virus. It's amazing. But have you ever thought about the survivors of the virus? Have you ever thought about how much mobility, how much strength, how much endurance they lose once their body has been attacked? We may not think about that so much, but tonight we're truly blessed. We have Dr. Judith Meer on. Dr. Meer she's done an amazing thing. She has created a website. It's called COVID Physical Therapy. And she's created this website to help survivors of COVID regain their physical function, because that's what we do best. So when I heard about Dr. Meer last month, I was so intrigued, and then I went on this website, and I was like, oh, I gotta have her on. I want her to tell the iMoveTelePT, iMovePT community about this. So I want to thank you for being here. If we haven't met before, my name is Dr. Michael Gorman. I'm a physical therapist based out of St. Louis, Missouri. I apologize for not being on the last few weeks. Life has been a little bit crazy, but I'm so happy that you are here to join me and to join Dr. Meer tonight. Before we bring Dr. Meer in, I want to ask you a question. You know, I love questions. I love to ask questions. But I want to know, because I personally, I haven't had anyone in my family or close friend that's been diagnosed with COVID. But if you could share with us, and by all means, don't tell names, but my question for tonight, and I'd like you to respond in the chat. Have you had someone in your immediate family or friend circle been diagnosed with COVID? So that's your question for tonight. Please let me know. A simple yes or no is fine. Just let me know if you've had any family or friends that have been diagnosed with COVID. All right. So I am going to bring Dr. Meer in at this time. Hello, Dr. Meer. How are you doing?
I'm doing well. How are you doing, Dr.
How are things in New Jersey, New York?
They are they're going. It's definitely better than it was earlier in the year. So we've sort of settled into a routine, which is an improvement on where we were back in March and April and May.
For sure. Well, I want to be totally transparent with everyone. And I've known about you for a month, but we just started talking about 15 minutes ago. And I found out that not only do you live in New Jersey, but you and your husband and your child and soon to be second child live on a boat. And that's very intriguing to me, because I live in Missouri where there's some water, but I don't probably have quite the scenery that you have.
Our view is the Manhattan skyline. So we are very fortunate for that, or unfortunate if someone doesn't like New York City, but we enjoy it. We're right near a state park, and we have the city right there as well. So the best of both worlds, I think.
Absolutely. Well, I'm going to tell everyone a little bit about you so you can sit back and just grin and smile, because you've accomplished quite a bit in your pretty young career. How many years have you been a physical therapist?
5 years.
5 years. Wow. I'm not going to tell you how many years I got on me. I got way more than that. All right. So I'm going to read this to everyone so they can learn about you. Okay. Dr. Meer received a BA in psychology from Barnard College, and she went on to pursue her doctorate of physical therapy at New York University. So she's been a PT now for 5 years. Several years after graduation, she found her passion in pelvic floor physical therapy. She is a firm believer in lifelong learning. She's taken extensive coursework in pelvic health topics through the renowned Herman and Wallace Pelvic Rehabilitation Institute, as well as the Women's Health section of the American Physical Therapy Association. Is it still called the Women's Health section, or is it Pelvic Health? Or
it's now the Academy of Pelvic Health. Yeah, they just changed it recently.
Awesome. She has a background as a certified strength and conditioning specialist. She is a wilderness first responder. What's a wilderness first responder? That's pretty awesome.
So I worked for many years as an outdoor guide, taking folks, hiking, kayaking, climbing, and one of the requirements is that you have not just sort of your first aid or CPR, the things that we might already have
Right.
as physical therapists, but that you also know what to do if you're in a wilderness situation where the only thing you can build a splint out of are some sticks that you find,
Yeah.
or how to use your backpack to get someone out if they get injured. So it's sort of a specific to wilderness situations kind of first aid.
Very cool. I hadn't never heard of that. Now,
Mm.
if anyone thinks they want to mess with this young lady, you don't want to mess with her because she is also a Krav Maga, right? Am I saying that
Krav
right?
Maga, yeah.
Krav
Krav
Maga
Maga.
self-defense instructor.
Mhm.
So if you think you want to mess with her, you better think about that twice. And she's the owner of the Pelvic PT, which is a private practice in Hoboken. Or so not Hoboken. Hoboken? No.
Yep.
Okay.
Hoboken, New Jersey.
Hoboken, New Jersey. So we welcome her and thank you for giving us your time on a Thursday night.
Happy to help.
All right. So before we get started, a couple of people are on. Laura's on. So these are the people that responded to whether they have had someone in their family or friends have been diagnosed. So Laura says yes. Brian, hey, Brian. Brian says yes. Stephanie says yes, Anise. And Cindy Plaster just says hi, Mike. So I'm hoping that means she hasn't had anyone diagnosed yet. But anyway, if you have questions, comments, guys, please type them in, and we'll do our very best to answer any question that you have. Let's make this interactive. As always, give me a thumbs up, the wow symbol, the heart symbol, whatever you want, but make it interactive. And let's get rolling talking about COVID physical therapy. So 5 questions.
Mm-hmm.
5 questions for you. So this is question number 1, not really question, but I want to know, we've already talked some about your PT educational journey, but I want to know what you specialize in as a PT.
Sure. So I'm a pelvic physical therapist, which means that I primarily treat bowel, bladder, sexual issues, chronic pelvic pain, and acute pelvic pain. I like to say that if you put one hand on your belly and one hand on your bottom, and you think about all the plumbing and the muscles and nerves and joints and everything going on between those hands, that's the bread and butter of what a pelvic physical therapist treats. I still work in orthopedic. I treat orthopedic conditions, knees, back, shoulders. I still love all of those, but pelvic health gets so overlooked and over medicated and shunned as an area of treatment because people are embarrassed to bring these issues up, or they or their medical team simply aren't aware that there's treatment that exists for a lot of conditions out there. So I hear that a lot. I wish my doctor had told me about this years ago. And the pelvic floor is a bowl of muscles in between the hips that holds up our organs. And it operates very similarly to many other muscles in the body, but it has farther reaching implications. So if someone can't play basketball with their buddies because their back or their hip or their shoulder hurts, that's unfortunate. We want to get them back to doing the things they love, but that doesn't necessarily mean that they're going to restrict their social life, their water intake, intimacy with their spouse in the ways that they might if they were dealing with incontinence or pelvic pain. So every day is interesting, and there's always more to learn. And I really enjoy helping people with this very intimate part of their bodies and conditions that they, in many cases, have searched for years for treatment. Whether that's a tailbone injury from snowboarding, or a new mom who leaks when she tries to pick up her newborn, or someone after an abdominal or pelvic surgery. So it's a lot of different conditions that we treat,
Sure.
but that's the specialization that I'm in.
And it's not just women. I mean, I'm sure, do you treat men and do you treat pediatric?
So I primarily treat men and women. I have quite a number of male patients that have started recently, which is great because that means that some of the urologists are starting, and colorectal surgeons are starting to realize that what we can offer. I don't primarily treat a lot of pediatric patients, and for pediatric, you're not doing any manual or hands-on kind of work. A lot of that is behavioral. So an 8-year-old who is chronically constipated, older child who might have started bedwetting again, things like that. And there are more specialized folks in our area that I often refer out to, just so someone's in the best hands.
So are your kids going to be potty trained like by the time they're 18 months old?
I'm definitely that mom who's like, that's perfect positioning. Good job, So yeah, and I'll be able to answer all those questions, when my little boy grows up that he might have with,
Yeah,
detailed anatomical models as well.
for sure, for sure. All right. So really the topic tonight and what I was really intrigued by was this website, COVID Physical Therapy. Can you just let the audience know a little bit about what that is? And I guess how it came about, because I love it. It's innovative, it's outside the box thinking, and it's such a huge need that honestly, I didn't even think about. But how did it all come about?
Yeah. So the website for those who want to check it out is covidphysicaltherapy.com. On it, you'll find expert interviews, which we're going to continue to add to, free resources, uh, videos that are for whether you're laying down, standing up, breathing, pelvic health, a wide range of things that we'll also continue to add to. Um, but to answer your question about how this all came about, I think if we start with the biggest picture, which is about our whole field, physical therapy started as a discipline in the 19th century in the aftermath of World War I, and also as the polio epidemic was spreading through the United States. And there was this need for reconstruction aids, as we were called at the time, folks who were there once the fever was down and the stitches were out, but someone wasn't still adequately functional and needed help with their recovery, someone who could test the muscles and re-educate them, restore function, and help folks in that process. And so we fast forward to 2020, and we have another pandemic on our hands with COVID-19. But we also have a healthcare system that is fundamentally broken, which means that for a lot of folks, job loss means that they're losing access to healthcare, and people won't be able to recover or have the means to recover as fully as they could if they had access to healthcare in the way that they might in other countries. It's also worth mentioning that folks of color have been disproportionately affected by this virus, 3 times as likely to get it, twice as likely to die, not just due to increased numbers of Black and brown folks working as essential and frontline workers in healthcare and delivery and construction, et cetera, but also due to comorbidities like diabetes and heart disease and obesity that we know are rooted in longstanding issues, access, to healthcare and systemic inequalities. So there are amazing and skilled subacute and outpatient and home health PTs out there doing that hard work on the ground with folks who are recovering, but there are also many people who are slipping through the cracks right now, and they don't have access to services, and they are making hard choices about paying for food or paying rent or continuing to work on their recovery process. And often we don't take care of ourselves if we need to take care of our families first. So, and we also know recovery is this daily incremental process. So 1 or 2 hours a week of physical therapy really just may not cut it. So that is a very long-winded intro to say that I had shut down my practice in mid-March to in-person visits. I was doing some virtual consultation and taking care of my toddler. But joining colleagues on the front lines in hospitals here wasn't the right choice for my family. But making the COVID physical therapy website was an opportunity for me to take my physical therapy skills and my husband's superb web design and development skills, and be of service in a way that takes a lot of the medical info that's out there and a lot of the jargon that's out there and translates it into something that is easily accessible and digestible. And if our website can offer some useful tips and tools and help folks who otherwise wouldn't get that care or wouldn't know where to get it, then we've done what we set out to do. So we're keeping the website free forever. We're absorbing all of the costs. And as I said before, I'm very grateful to folks like you, Dr. Gorman, for helping us get the word out there, because that's really what we want to do, is just let as many people know that there's some good resources if you know where to look.
Yeah, I was just when I looked at the website, I was just amazed because I could tell it definitely took you time to put this together. It's very well thought. It's well thought out, very clean, and just what a great resource it is. And so I think when people saw what the title of this live was going to be, I wonder if people, does someone have a brick and mortar clinic where they're doing it? No, but what's so amazing is that this is something that you've given your time, you and your husband have given your time to create, and there's such a huge need for it. So let's make sure we blast this website out to as many people as we can. So now that we know like how this started, you know, I haven't treated anyone that had COVID, so I don't have any experience with this. And like I said, no one in my family, thankfully, has had it. But is this a question you can answer? I mean, have you worked with someone that has had COVID, or to maybe talk with friends that have worked with this? And what are the real physical limitations that we could see as a provider, whatever, a month, 2 months, 3 months, 6 months after the fact?
Yes. So I have treated folks who have had COVID and have recovered. I am in full PPE when I'm back to treating right now. My clinic has reopened to in-person visits.
Good. Good.
And there's quite a list of what we're seeing. There's weakness from prolonged bed rest that can make things like balance and transition, so going from sitting to standing or supine laying down to sitting up, quite challenging. There's often reduced lung capacity, shortness of breath, sometimes a fear of movement just because of that shortness of breath. There's this deep-seated fatigue, which we're seeing go hand in hand with that decreased tolerance or capacity for exercise. Even from a pelvic health standpoint, since that's what I think about a lot, constipation from some of the medications that people are on, and that same lack of movement. The digestive system needs movement, and hypertonic or tight pelvic floor muscles that can have bowel, bladder, or sexual implications. Fun fact for you, the pelvic floor is one of the first places that tightens in response to threat or perceived threat or stress, and it also is deeply affected and impacted by how we're breathing. So changes in our breathing strategy, which we know is going to happen with a respiratory virus, will also impact the pelvic floor and how it functions. And even issues from catheterization. So, folks are having a tube inserted to extract urine, and they're in the hospital for an extended amount of time. Sometimes that can affect pelvic function as well. So teaching techniques for energy conservation, breathing strategies, some of that pulmonary rehabilitation, how to safely ramp up exercise. And, that's all part of what we deal with as PTs. But specific to COVID, which is just one of those sort of, one of the fun things we get to deal with this virus, we know that there are some long-term implications, and that includes things like scarring in the lungs, myocarditis or inflammation around the heart that can increase the likelihood of sudden cardiac arrest sort of events, sometimes with very little warning, joint pain, weakness, muscle weakness. I think the last stat I read was that 80% of Americans are inadequately active. And so we have a population that's already too sedentary for their own health and well-being that is going into an illness that can really kind of knock them out flat on their back. And then even Olympic athletes who've been stricken with COVID are finding that return to their sport quite challenging because of the nature of the virus. So that's where, and I'm obviously a little bit biased in this, but working with a physical therapist is a great way to improve that strength and that mobility and that endurance, and have a supervised and a personalized exercise program to get someone confident and functional again. But as I mentioned before, that's not always feasible for everyone. And the goal of the website is to maybe just give some people, give people some preliminary, bit more generic advice, but a starting point to get them more confident. So
that's great. That's great. Yeah, it's again, all these things that we don't think of. Sometimes we turn on CNN and just look at the amount of people that have passed away from this, but all the people that have had it and obviously did not die from it, those are the people that are dealing with this every day. And I'm amazed because now that a lot of the pro sports are back, it is pretty amazing to me how some of these athletes are coming back so quickly after being diagnosed. And I know that it hits everyone its own way, but I bet even though they're back playing, I bet if they were honest with you, they would tell you that they're not to the same physical capacity that they were, which then sort of brings me to my next question. This is general, so again, there's no one answer, but if you've had COVID, how long would you think it would take to recover physically to where you were pre-COVID?
Yeah, so that's a great question, and the answer is obviously it does depend. It depends on well, part of the issue is we're not even a full year into this pandemic. So in terms of long-term data, we simply don't have it yet. And as you know, recovery is a very individual process. Two people with the same shoulder injury will recover very differently, just based on their age, their health history, their own psychological or personal outlook. And in this case, it's also it's going to be the severity of the virus itself. What we know so far is this: someone who was on a ventilator while in the ICU or the intensive care unit is likely going to show some signs of ICU acquired weakness, a huge decline in muscle mass. We lose about 10% for every week that we are on bed rest. And that can take up to a year to recover, to really recover fully. More specifically, someone who had ARDS or acute respiratory distress syndrome, which is often a reason why folks become mechanically ventilated when critically ill, they can still be showing issues in terms of pulmonary function 5 years down the line. So for people who were quite ill, they may have a long road ahead of them. The same folks, because of what we know about post-intensive care syndrome, which was a term that started in 2012, they're seeing this constellation of symptoms that is not just physical, but is also cognitive and psychological. So increases in depression, in anxiety, in memory and memory loss and cognition and problem solving. All of that is potentially something to look out for as a provider, because that may get missed, or someone may fall through the cracks in terms of getting access to that kind of care. Someone with a milder but is still significant, who is still significantly affected by the virus, maybe they were at home, they didn't end up hospitalized. For those folks, you're going to see a couple weeks to a month and a half for recovery. I think the World Health Organization right now is saying about 6 weeks or so. That's assuming that they are getting access to care and recovery, and some guidance on that. But I'm really glad you brought up the thing about young athletes getting back to sport, because there have already been, I know of at least 2 or 3 that I've read of young athletes dying from that myocarditis, that inflammation on the heart from a cardiac event, and then from blood clots, which is also part of what the COVID virus does in the body, is increase some of the clotting factors. So those are big concerns, and especially as sports ramp up, I'm hopeful that these young athletes will get back out there and have a great time and enjoy their sports. But it is concerning because we just don't know. And as with so much that is new about this virus, the severity of the illness and any pre-existing health conditions are going to make that recovery longer. But even some of these younger folks that seem fine, there may be something going undiagnosed that we just don't really know about yet, which is a little scary.
And I would say, well, real quickly here, Michelle chimed in. She goes, "Hello, Judith and Mike." Hi, Michelle. And Yusuf, who's a very good friend of mine, he's a physical therapist in San Diego. He said, "Well summed, Dr. Meer." So very good.
Thank you, Yusuf.
But if there's any physical therapists that are on this now, we had a max of 11 people, so good job. Sometimes I've got 3 on these, so people wanted to hear this. But I really want to impress upon, if there's any therapists that are on this and hear this, you need to be talking to your primary care physician referral sources and let them know what what we can do as a profession to help these people that have had COVID. So, just from not only obviously when we want to help the health and the wellness of these people, but from a business standpoint, you need to be aware of this. And I think this can be a huge referral source, again, depending on the city you're in, depending upon the area, but we have the skills to rehab these people. And no offense to a personal trainer, but we have to have a little higher skill set, and we have the ability to functionally rehab these people and look at the vital signs and get a good medical picture of what's going on. So let's start treating these patients, either whether you're treating in a clinic or if you do home care, wherever. It's going to be huge, because I don't want to get into a big political thing, but this probably isn't going away anytime soon. So, and as you said, I think the effects are going to linger for years. So Um,
I'm so glad you brought that up about the personal trainers, which is one of the big concerns I was seeing early on. At some point in the summer, I came across something on Facebook or on some social media of some personal trainers that were advertising how they could help. And that just as a physical therapist, there are some wonderful personal trainers out there. There are some highly skilled personal trainers, but I have a lot of concerns about someone who doesn't have the training in cardiopulmonary rehabilitation, who doesn't have an eye for, hey, this person's balance is a little bit off on one side. Do we need to start thinking about maybe some neurological insults or injuries that may have occurred, or looking for blood clots if they're just thinking, I got to push this person, especially with some concerns around exercise tolerance. This is not the time to be necessarily going, uh, get down and give me 20 push-ups, because that may really hurt someone right now whose body is still recovering, even if they may physically outwardly look okay.
right.
So I'm glad you brought that up, because that's certainly a concern, and this is a unique opportunity for our field to step up, just like we did when we started in the polio epidemic. This is a chance to be the voice of recovery, and not take a back seat to some of the other people that are in the exercise field.
Yeah, we just have to, I think, not to go off on a tangent here, but we as a profession have to start being able to speak up and let people know what we do and our skill set. And we are doctors. And that's why I'm so happy to call you Dr. Meer, because every time we've communicated, that's how we talk, and you have an incredible skill set. Ron wants to know, how does a PT treat lungs, like for shortness of breath?
So I'm glad you asked. There's actually a little section on the website about some of the breathing exercises that are out there. In terms of some of the techniques, there are things like pursed lip breathing, which is thinking about it's almost as if you're trying to blow air out through a coffee straw. What that does is it allows the lungs to expand a little bit more, get a little bit more air into the alveoli, into the little sacs in the lungs. There's stacked breathing. And again, you'll find some of these videos on the website as well. But it's breathing techniques to help increase lung expansion if there are areas of scarring or fibrosis where the tissues aren't moving as well, working on stretching those areas. Some of the hands-on techniques that PTs will do will include some rib mobilizations if things are stuck. You think about someone who's laying in bed and their intercostals, the muscles between their ribs, haven't been moving as much. They haven't been walking. They haven't been stressing that system. And just like if you didn't, if you walked around with your shoulders hunched up all day, you're going to get some tension here. If you're sitting in bed and you're scared to move and it's hard to breathe, you're going to start getting some tension and some restriction also just in the muscles of the thoracic cage of the torso. So working on that hands-on as well is absolutely important. And then if someone got pneumonia, which some folks are coming into the hospital with, pneumonia as part of their COVID journey, they may still have some issues clearing their lungs. So teaching people how to effectively clear their lungs. There's something called active cycles of breathing techniques. And that's something that we actually have to put a video up on about that, but you can look that up. There's some good YouTube stuff out there, mostly out of the UK, I think. Okay. But with some techniques on how to do that.
So I was going to ask you a question. I just forgot what I was going to say. I know what I was going to say. I was going to say that, one thing we really haven't talked about is just when someone has been diagnosed with COVID, I can only imagine the amount of anxiety that one would have once they were told that. And with anxiety comes muscle tension, muscle contraction without us even knowing. So there's a whole thing we could talk about for an hour about that, about the things we could do to help to decrease, not only from a manual therapy standpoint, but from a gentle exercise standpoint. You go on and on, because we can't separate the mind from the body, because the mind is controlling our body. So for sure.
Yes. And especially with breathing, if someone is breathing up here, right, kind of that apical or chest breathing, which is the way that we breathe when we're stressed, because there's a global pandemic going on, whether or not we are ill from it, versus that belly breathing that if, you watch your kids when they're sleeping, they breathe like that, and they're, that nice calm breathing, or the way we do, hopefully, when we're on vacation. That belly breathing activates our vagus nerve, which is, the one that feeds the parasympathetic, the rest and digest nervous system. So I tell folks, check in with your breath throughout the day. If you're stressed about the neighbor I don't know, your kid screaming up a storm at the store, or whatever's going on, you're stressed because you're worried you may have come into contact with the virus. Notice your breathing, because that's also a way to kind of regulate that, how you're feeling in your body. It's that mind-body connection that we know is so important.
Absolutely. One more question for you. So Ron, again, what about a case where one lung is shorter than the other, shrunken lung? I'm not really sure what that means. So I don't know if we're getting like into the chest PT world with the percussion and all those kinds of things.
Yeah, some of that, so the breathing techniques will be applicable regardless. If someone, that would be different than something like collapsed lung, which would be a medical condition. If someone has a lung that is smaller, that would reduce likely their breathing capacity. But I'm not sure how that would. I don't have enough knowledge about how that would particularly apply in terms of treatment.
Here's one that's pretty good. Any thoughts about using blood flow restriction with COVID patients?
So there's some really interesting research on blood flow restriction. I would be really concerned to do that with patients that I know have been diagnosed, or that, with our asymptomatic patients, we just don't know, simply because of the clotting concerns and simply because we just don't have enough data right now. And I certainly don't want to be the therapist that goes, okay, we know this works from a musculoskeletal standpoint,
Right.
but and some of the research behind it certainly validates that, and I've seen great things, but this factor 5 that is creating these clotting cascades is really concerning, and so I would be reticent to do that in a patient that I know has been diagnosed or has recovered from COVID for right now, just because we don't know yet.
Right. I agree. Okay. Yeah. Well, Mo, this has been awesome. So my last question, what mantra do you live by? This is one of my favorite questions. I like to find what people, kind of what makes people tick, but I want to know what your mantra is.
Oh gosh. I guess it would be make it happen. Make it happen.
And you have.
Yeah, it's easy. It's easy to take it easy, but life is way more interesting if you keep learning and exploring and growing and pushing your boundaries and living in a way that keeps you feeling fully alive, whatever it might be at any given moment. It's a goal to work towards, and if you don't get there, it's a way better story than saying that you sat around on the couch for 2 months eating Netflix, or watching Netflix and eating chips
and watching Ozark.
Right? And watching Ozark.
Yes,
exactly.
Yes, Ozark. So I'm going to throw your contact information up here. So if anyone would like to talk with Dr. Meer about anything, this is her email address, and I put the 2 websites up here as well. I want you guys to please share this, because I'm quite sure that almost everyone soon will know someone that has had COVID. Get them to the covidphysicaltherapy.com website. Dr. Meer has done an amazing job. I'm so impressed with what she has done, and her husband. We got to give her husband credit.
Yes.
But just so impressed, and it's going to help so many people. We just have to get it out there. So please, guys, spread that, put it on your social. That would be fantastic. But I am thankful for your time tonight. I'm thankful for people like you, Dr. Meer, that make it happen, really.
Thank you, Dr. Gorman. Thank you. I'm very grateful for the opportunity to get the word out there.
I hope you have a great night. Enjoy your boat. And good luck. You're due in about 4 months, January?
Yeah, in end of January.
All right. Well, if you need anything, you call me, but everyone get the word about covidphysicaltherapy.com out. And if you live in New Jersey and you have any pelvic health or any neuromusculoskeletal issue, go see this Dr. Meer. Go see her, because, and I mean, I want to make you so busy in your clinic that you have to grow and have 4 of you out there. So.
Oh boy. Well, thank you. Thank you.
Well, have a good night and have a great weekend. And thanks again for your time.
Take care. Have a good one.
All right. Bye-bye. All right, everybody. Thank you so much for being a part of this tonight. Great topic. Fantastic topic. So please spread the word. covidphysicaltherapy.com. I will see you again in 2 weeks. I already have my guest lined up. I'm very excited about that. I'm going to leave it as a surprise for now, but she will be on in 2 weeks. So I'm very much looking forward to that. So as always, stay home, stay strong. And thank you so much again for your time tonight. Have a great Thursday night and a great weekend. Take care. Bye-bye.